Play therapy can be a key aspect to occupational therapy by Kaylin Stanley, a Gordon State College student. What is play therapy? Play therapy is a type of therapy that allows the child to have control of the session. In play therapy, they often use dolls, action figures, or toys to act out stories to the therapist or to show how they feel. In play therapy, the children also play games in order to have a fun way to learn things like taking turns and how to share. Toys are also introduced that are meant to help the child with their fine motor skills, such as balls that have lights, levers, and buttons, as the one seen on the bottom of the screen. Play therapy helpful to occupational therapists. Play therapy allows the child to feel like they have control over the session and are more likely to actively participate. Play therapy is beneficial for troubled children and for children with mental or physical disorders. This style of therapy engages the child and will allow the child to show you what works best for them, whether it be coloring, toys, or games, to help you work with them. That's the goal. Many children's occupational therapists are using too many traditional styles of therapy instead of seeing what works best for the individual child. Play therapy, or mixed with other therapies, allows the child to get the treatment that works specifically for them in a fun manner where they will want to learn these skills. Troubled children. Children that were detained in a detention center aged 14 to 18 were put into group play therapy. Previous attempts at therapy were not successful until group therapy was introduced. This therapy involved doing surveys, art, and worksheets. After the study was conducted, the research shows that 90% of the work was completed and pertained to the discussion. These discussions involved topics like relationships, culture, and self-awareness. When therapy was introduced to these children, it was a fun and creative way to discuss difficult topics with their peers. It may be easier for the child to start with this style of therapy. That way they are not faced with the intimidation of face-to-face sessions. This approach showed successful with troubled children, but it can also be applied to children that have a difficult time controlling their emotions and outbursts, such as children with Tourette's and ADHD. Autism. Children who are diagnosed with autism spectrum disorder often have a difficult time with social interactions, verbal skills, and emotional control. Play therapy can help the child communicate through toys, even if they are nonverbal. When studied, autistic children show higher improved play performance than normal child control group. 4/5 of the autistic children showed higher play performance than the control group. As a professional OT, you can have the child participate in sensory integration therapy using the fundamentals of play therapy to improve the child's progress with sensory overload and concentration. These sensory processing difficulties are associated with behavior and socialization problems and affect the education, relationships, and participation in daily life. Sensory integration therapy, also known as SIT, is a face-to-face therapy or treatment provided by a trained occupational therapist who uses play-based sensory motor activities and just right challenges to influence the way the child responds to sensations, reducing distress, and improving motor skills, adaptation responses, concentration, and interacting with others. ADHD. A study was conducted on children with attention deficit hyperactivity disorder, also known as ADHD, to see the effects of play therapy on interpersonal relationships, play/leisure time, and coping skills. Children ages 2 to 5 years old were studied for 24 weeks, having 2 60-minute therapy sessions a week. These sessions involved role-play, turn-taking, and following rules. This therapy taught the child to cope with their ADHD and how to live a normal child life. This therapy focused on teaching basic principles to correct the child's ADHD tendencies, such as blurting out and not sitting still. This therapy can be highly beneficial for children who have ADHD who are about to start going to school, thus to equip them with the knowledge of how to focus, control outbursts, and sit for the entirety of the school day. OCD. Pairing play therapy with other types of therapy can be beneficial for severe cases. Toby was a 3-year-old boy with obsessive-compulsive disorder, also known as OCD, who received psychodynamic therapy for his self-defeating behavior, idiosyncratic routines, and controlling behavior. By pairing the two therapies, he was able to make great progress. The psychodynamic therapy brought out his early childhood trauma to surface, and the play therapy was used to help treat his OCD from knowing what initially caused him to start being this way. Pairing play therapy with food therapy. Play therapy can be added to other therapies such as food therapy. Food can be presented in a fun play setting where it is okay to play with your food. You need to gently increase the amount of food presented in a fun play session so that the child becomes more comfortable with food. This will help the child get over the fear or misunderstanding of food and how they should eat orally. In a single case study of an oral feeding child and a non-oral feeding child, both were presented with a mixed feeding/play therapy, and the non-oral child showed greater progression through the therapy than the traditional feeding child. As an OT, this knowledge can be very beneficial to know. If the child can have fun and enjoy what it is being taught, then they are more likely to succeed in that therapy than if the child were miserable or bored during each and every therapy session. Conclusion. As shown above, play therapy is a great asset that occupational therapists can use. You've been given 5 different patient examples: troubled, autistic, ADHD, OCD, and paired with other therapies such as feeding therapy. These patients have been studied and show greater progress when play therapy is included into their therapy sessions. Many more illnesses and disorders can benefit from play therapy. You have to find out what works best for each and every child. Play therapy just allows them to show you what they prefer. Never give up. A therapy style may work for one child, but not another with the same disorder. Everyone is different. Keep trying new things until the child is comfortable and starts to show steady progression. Works cited from academic case study journals.